Dr. Joanne Liu knows the dangers of Ebola all too well. As the head of Médecins Sans Frontières, she's seen the ravaging effects of the virus as well as the global panic it's creating. But how do you contain a disease without borders? Last December, a young boy died from flu-like symptoms in a remote African village. 9 months later, Ebola is wreaking havoc on 4 West African countries. Over 2,000 infected, more than half dead. An outbreak of unprecedented and historic proportions. But this outbreak is different. Spreading from rural borders, for the first time ever, Ebola is urban. Striking some of Africa's busiest, densest cities, a worst-case scenario. Doctors Without Borders has been leading the response with boots on the ground and decades of Ebola fighting experience. It sounded the alarm early.
We had around 40 patients from one village. It's unbelievable. I never have seen it before.
In March, it called the outbreak unprecedented and called for aggressive action. Today, it has more than 1,000 staff fighting the outbreak. But according to its international president, it's not nearly enough.
I really had the feeling that it is like a wartime in terms of fear, general fear.
And just as challenging as the virus, the panic it causes. Recently, communities have driven out aid workers and looted treatment clinics, taking with them potentially deadly blankets and mattresses. Dr. Liu has just come back from Liberia and the isolation area, where she got a first-hand look at Ebola's devastation. I caught up with her in Montreal. I want to start with today. We've seen in Liberia this situation of panic where people who were being held inside this quarantine area tried to get out, and the soldiers who were keeping them in opened up with live fire. What does it tell you about the panic that's going on in a place like Liberia?
When you don't know what's going on, it's what's happening to you, and you are in the unknown, then you're scared, and your scare will quickly shift into panic. And the population, generally speaking, do not understand what is going on. And when someone or a government try to implement such coercive measure, it needs to be explained. Otherwise, it will never work.
Doctors Without Borders, your organization works all over the world, working in Syria right now. But you have said that what is happening in West Africa, in Liberia in particular, is so much more pronounced and so much more difficult than a war. Why is that?
Well, so much more difficult. I think everywhere we take enormous risk, but the reality is if I take the example, when I was in Syria, there would be airplane attack, and then I will hear the plane, then I will hear the bomb falling, and then the siren will come and the patient will come in my ER, and I will take care of that patient. But that would be that episode, and then for a while, there'll be nothing happening. But what is going on in Ebola is wherever you are, the risk is there. And then so you are in the center, taking care of patients infected with your personal protection, and it's right there into your face. But then once you're out of it, you cannot let down your guard because you don't want to make the wrong act that make you, I would say, infect yourself. So if you touch something, oh, you don't want to rub your eye. So the thing is, sometimes we are a bit in this, I would say, a bit of a psychosis about it, and that's normal, and we have to somehow fight that. But like one of my colleagues told me, he said, it's like being on the front line and having a machine gun shooting at you all the time.
This is a terrible subject, but you've seen people dying of this. What's it like to see people dying? What is that death like?
I think that was the most difficult part of my visit, was to be in the Ebola center and seeing people dying. And what I thought was the most distressing is I remember clearly that patient, he looked at me and said, "Doctor, doctor." So I bent down to him, I looked at him, and he was sick, so I brought a bucket, hold his hand, and he looked at me and said, "I'm bleeding." I said, "Yes, you're bleeding." And then I gave him, a piece of paper, and then I said, "But you'll be fine." I said, drink more, drink more." But I could tell in his eyes the panic, and I could tell that the angel of death would probably come soon. And what's the most distressing thing is to realize that he will be dying without his loved one. And the only people that he has around him is like someone in a spacesuit, that he can't even see his smile or his face.
This is a 6-year-old.
Yeah.
You have had in Guinea doctors attacked, clinics attacked, in Liberia clinics looted, patients who left in a panic. What cultural barriers are you facing there as there is this panic and misunderstanding about what Ebola is?
Our experience in Guinea at the beginning, people were basically throwing stone at us when we arrived there. They thought we were bringing the Ebola. And they thought that once we have our center, since people were bleeding, they thought we were taking organs away from them. And then what we ended up doing is we sat with the elder, we sat with the religious leader, and then we explained them what it was. And one of the best things we've done, and it was the place where we have the lowest case fatality rate, the percentage of death, was in the place where we put the center in the middle of the village. And then people, everybody knew what we were doing. And there were sort of window that they could see that even if we were like a cosmonaut walking around, they could see that we were caring for the people. And there, our case fatality rate was at least 30% less.
There is no cure and no proven treatment, but we know that there is this experimental vaccine, experimental treatment. What do you think about essentially experimenting on people?
Yeah, that I guess is the question of the hour right now. And I think this is something that we need to look into it. On the other hand, what we need to be clear is for this epidemic, it's very unlikely that's going to be the solution to solve the current epidemic. It will probably help us for the next time around. What we need to do now is to prevent people from being infected. As for the vaccine, we need much more, I would say, guidance from researchers to find out what would be the criteria to use it. But right now, we are so overwhelmed in treating patients and caring for patients that we will need extra help if we were to put that in place.
What is it that you're overwhelmed with?
Well, just for an example, is right now in Liberia, in the county of Lofa, in Foya, we have taken over a center of 40 beds. And then within a few days, as of 3 days ago, we have 137 patients admitted. And all of a sudden, it was overcrowded. And it's the same thing in Monrovia. We opened this weekend a center of 120 beds. And within 1 day, it was completely full.
In 1 day?
In 1 day. And the thing is, this is why we know that there must be more cases outside that is not being seeking attention. Today, in Liberia mainly, people don't have access to basic health care because they've been closed. And they've been closed because A, staff has been infected, B, some of them have died, 3, some patients have been infected by healthcare staff who were infected, and it became a center of amplification for the epidemic. And so right now, we are facing the ridiculous situation that someone who has malaria cannot get his treatment for malaria. And this week, we had 6 pregnant women walking around the city in Monrovia and then end up coming to our center of care for Ebola for delivery. And by the time they got to our place, they have lost their child.
What is the one thing that you need most when you go to these meetings at the United Nations and the World Health Organization and within your own organization? What is the one thing that is so critical to get right now?
I think that right now, in order to get all, I would say, the resources together and use at the best, we need a body, an entity who will take leadership and coordination of the response to Ebola. And right now, it's not happening.
If no one steps up to the plate, no one takes the leadership role, what would happen?
No, someone's going to take leadership. This will not, I think that it will happen. I don't think it's happening at the speed and at the reactivity that it would have liked, but somehow I think that the WHO will step up to the plate.
You feel they have to, you think?
Well, the reality is, I've been telling the DG in WHO, is basically, I'm Dr. Joanne Liu, the international president of MSF. I've been calling for a disaster of paramount, I would say, threat for the rest of the world, Ebola epidemic, and nobody paid attention. She has the authority and the legitimacy to call for it. And she did it a few days ago. She called for a public health emergency. And that's fine. The statement is out. But now that the statement is out, we know there's no statement have saved life in the past unless it's followed up by concrete action. We need action in the field right now.
Ebola has gone from one child in a remote village and has now, for the first time, gone into major urban centers, very densely populated. What are your hopes for containment at this point?
Well, that's a very good question, and this is where we're navigating in the unknown. Because in our past experience with Ebola, it's always been in rural environment. And this is why it somehow died out very quickly, because the chain of transmission ended up dying out. People were not moving that much, and at the end, it self-contained itself. What is going on now, because it's in an urban area, like Monrovia, in the capital of Liberia, 1.3 million, we don't know how fast will be the chain of transmission. And this is why it's paramount today to bring enough capacity in the country to face Ebola. And what we need to do, us Canadians as rich country, is to send more capacity in the field, because it's not by barricading ourselves in our home country that will make a difference. What will make a difference to prevent a global threat for the rest of the planet is to contain it regionally by bringing more capacity in the field.
Thanks very much.
Thank you.